Welcome to another episode of Mera Doctor. We would be talking to ENT surgeon Dr. Prashant and about noise pollution. Welcome, Dr. Prashant. So, can you tell us in general what is noise pollution?
So noise is nothing but any sound which is, be it music, be it anything, which is beyond a certain decibel count, usually beyond 90 for more than a prolonged duration. And if it's 120 decibels, even a shorter exposure to it causes a pollution. So noise pollution is something which we can describe as a sound which causes deafness.
Okay. So, when we say that, it's beyond 90 decibels, generally when we talk about noise, it's something which is irritating. And some people tend to listen to music loudly, saying that's not irritating. But does that also categorize as noise in terms of medicine, or how do we look at it?
Yes. So any sound, be it music, be it someone shouting, someone talking loudly, or any fan or vehicle noise, traffic noise, anything beyond 90 decibel for a prolonged exposure. Prolonged exposure means more than 20 to 30 minutes can definitely lead to permanent noise, deafness.
So, not necessary that something which is a little soothing, maybe if it's a music or something else that we think is not really noise, it's still, when we look at it medically, it's still noise and it still has adverse effects.
Yes, you're correct. Nowadays, because of earphones, people tend to misjudge or miscalculate that it is not causing much of hearing loss. In fact, with the earphones, because it's placed very close to the eardrum, the effect is much more amplified. Even though people can't hear anything on the outside, but on the inside, when they're wearing an earphone and keeping the volume very high, that causes significant damage to the hearing.
Talking about the earphones itself, what about some of these headphones or earphones which have noise cancellation? If you've got that noise cancellation on and you're not really listening to music very loudly, does that also impact?
So, no. With noise cancellation, what happens is it cancels out the outside noise. Second to which, it improves the music quality. So you are able to hear what you are wanting to listen better. So because you are going to listen at a very much lower volume than your usual non noise cancelling earphones, the impact will be much lesser.
Okay. So those frequencies, that are used for noise cancellation, they don't really cause any effects, because when we talk about noise cancellation, it's cancelling out every other noise by producing their own wavelengths and frequencies, right? Do those waves also impact the eardrums?
No, since that is a white noise which is being created to cut out the external noise, it's not exactly very loud. It is a frequency which is given to cancel out the external noises by matching the frequencies. So it doesn't mean higher the frequency, higher the volume. No, it is not related like that. So higher frequency sounds are not always causing hearing loss, but the noise pollution can cause higher frequency hearing loss, which is usually seen.
Coming back to our noise pollution itself, there are different categories of noise pollution. We talk about these industrial noise and all these vehicles. And I think in life in a city, there's a lot of exposure to noise. So does that mean that most of us living in the cities are prone to effects of noise pollution, irrespective of how much precautions we take? Or does that mean if you can actually take good precautions, we can actually prevent a lot of these effects of noise pollution?
Yes, noise-induced hearing loss, as we term it, is definitely a preventable disease. So you can prevent hearing loss from noise pollution by ensuring that you are not exposed to it.
Mm-hmm.
So if at all you are exposed to loud sounds, the best way to prevent yourself or prevent the hearing loss is just by closing your ears like this. So it automatically cuts down 90% of the noise. So you will be safeguarding your ears.
So I think nature has been preparing us actually to take care of ourselves in that way, right? Because I've seen children very commonly do that, the exact thing. They just close their ears with their hands. And so you're saying that's the best way to actually prevent effects of noise pollution?
Yes, especially when there's loud crackers, loud speakers, loud noises, anything nearby. If at all it's bothering you, close. That's the best reflex you have by yourself.
Of course, not while driving or riding, but otherwise, wherever possible, try and use the hands to prevent that. But when we talk about industries, there are so many of us who work in different industries, who are working with a lot of heavy machinery around us. It need not necessarily be heavy machinery. It could be somebody working in a server room in IT. It could be somebody working in the field in manufacturing, in assembly line. All these things have a lot of noise. So all that noise you're saying is something which is definitely bad.
I would simply just say noise is bad.
Okay. Any noise is bad.
Any noise is bad.
But there are different frequencies, right? What I've read is that below 80 decibels, it's something that, it's okay for human beings. Is long exposure of sound below 80 decibels also harmful, or how does it work?
Any constant exposure will lead to death of the ear cells, the hearing cells. So anything noise, anything at any decibel, anything which is prolonged is always harmful.
And what are some of the effects if we may not be really realizing it, that we are exposed to a lot of noise pollution? Because I think that's one of the most silent types of pollution, in the sense that although there's a lot of noise there, it's not silent per se by definition. But when we look at the different types of pollutions, what we tend to get bothered about more is usually the other types of pollutions than the noise pollution itself. So how do we identify that we are actually getting exposed to a lot of noise pollution? Are there some symptoms that can indicate that?
Yeah, definitely. So the first symptom would be whenever someone is conversing with you in normal voice, you tend to miss a few words.
Mm-hmm.
You will keep the TV volume very loud.
Mm-hmm.
When you're conversing on the phone, you can't hear the other person clearly what they're saying. So you prefer to text or do an alternative form of communication.
Mm-hmm.
So these are the very common symptoms which are seen.
Isn't that directly related to only deafness, or is it also related to other things also? Or somebody who's prone to become deaf in the near future, probably they're able to see some of these symptoms. What I've also read is that it does impact and affect hypertension. It also makes people lose sleep, and I think for children, the brain development is also affected. So when we talk about all these effects, how does this directly impact? I mean, how does noise impact all this?
Like as you told, hearing is a sense.
Mm-hmm.
So when one of our senses is getting affected, it doesn't affect that one sense. It affects the whole body.
Mm-hmm.
Because human body is a full complex series kind of a machine. So if one organ or one sense is affected, obviously everything will be affected. Okay. It's like a chain reaction. So if you are exposed to noise, you obviously won't be able to sleep.
Mm-hmm.
That's why your body in a defensive mechanism makes sure you don't hear that noise by going deaf. And
okay.
That's how it's kind of protective, but again, it's affecting in another way.
So deafness itself is body's own way of dealing with noise pollution, which is a very big adverse effect.
Yes.
That nature gives us, but something that we definitely don't want, right? So when we talk about these different types of noise pollutions, we spoke about how you can prevent it with your hands, right? But otherwise, like I said, these symptoms, do we see these symptoms at early stages of exposure to noise pollution also, or does it always happen after a certain threshold?
Well, the most initial part which can affect would be you would not be able to hear the higher frequency noises, because the high frequency noises or the hearing is what is going to be affected first with hearing, with noise pollution rather. So the first symptom would be you would be missing out on the chirping of the birds, the buzzing of the mosquito, or the fly when it's flying around, the sound which you get. Those are the first things which will be lost.
Okay.
So if you are a nature freak and you have a high frequency hearing loss, this is the first symptom which you notice. Others would be, they would be missing out on any high frequency sounds which come out from your machines or anything like that. Those are the things which a techno freak can miss out on. And also people miss out on the higher tunes of music, so they become tone deaf.
So they are probably listening to the same song, but they don't really hear all the tones, all the notes that are actually there. They might still be listening to it very loud and causing more deafness.
That's the reason why many of them don't go for hearing testing at an early stage. Ideally, every year you need to get a hearing testing done.
Okay, so it is always recommended to get that
especially done. For people who are staying inside the city.
Every year?
Every year.
Okay, that's something which is definitely
missing
news
out
to me. Yeah, because I was thinking that just get a general body checkup, ensure that your lungs, hearts and kidney is working fine, and it should be good. But you need to take care of your hearing also, especially in the city, is what we're talking about.
Exactly.
So, and then when we talk about the effects of noise pollution in general to not just people, right, the nature, does that also have an adverse effect, as in not a direct effect? Directly, of course, human beings are affected by noise pollution. Do you also see some indirect effect because of noise pollution?
Yeah, as you just mentioned, people can't sleep properly, people have developed hypertension, and as I told you, it's all interconnected. So the noise pollution per se will also, if someone is having a heart issue, if they're exposed to loud noises, they'll have effects for their heart also. They can have a myocardial infarction or a heart attack. So these are the effects which are definitely seen with noise pollution.
Okay, thank you, doctor. So I think we've understood that noise pollution is something we shouldn't take very lightly. It's taught in the schools. We know it's one type of a pollution, but then we generally tend to ignore it because we are so busy with our lifestyles, with all the motorized vehicles running next to us, hospitals and offices and colleges with a lot of noise of their own. I think we should stop ignoring it and ensure that we visit our ENTs or doctors regularly to get our hearing tested as well, to try and prevent any adverse effects of noise pollution.
Perfect.
Thank you, Dr. Prashant.